Welcome back to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. Today we are going to talk about what I think is a super important topic that needs to be talked about before it happens, but unfortunately I know it just never is. And that is what happens when you need to be in the hospital and you have an autoimmune disease. For those of you new to the channel, thank you for stopping by. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness because we believe it's all connected. If that sounds like something that you're into and you want to hear more about, make sure you subscribe, like this video, it really helps us out. All right, so let's get started. Okay, so the truth is only a minority of patients with autoimmune disease will ever really need to put this information in action. Only a minority of patients end up having to spend any time in the hospital. And I also need to just drop this one caveat that some of the information I'm going to talk about is really only specific to situations here in the United States. I am certainly not an expert on the healthcare system or hospital systems of other countries and can only really speak to my experience here in the US. So let's start with why you may need to be in the hospital. Why can't whatever needs to be done, whatever treatments or whatever tests, why can't it be done in the clinic? And it's a very good question. And there's a number of different circumstances that may arise that will kind of require the hospital level of care to best take care of you. So the first circumstance may be that the medications you need to be given through an IV or need to be given through an IV and in a carefully monitored environment. So that could include antibiotics, it could include high doses of methylprednisolone, or even certain cardiac or pulmonary medications. Another possibility is that the testing you need to kind of get to answers as to why something is going on, the testing you needs to be done quickly. Now, this is a little bit on the border as far as whether or not it's a good enough reason or strong enough reason for you need to be in the hospital. Many clinics and hospitals and insurance companies will argue that you can get testing done as an outpatient and don't need to be in the hospital. But just so you know, if someone is needing multiple MRIs, a biopsy, maybe some sort of other interventional radiology type test done, then sometimes it just makes more sense to have that person in the hospital. Another circumstance is if your vital signs are unstable. And when I'm talking about vital signs, I'm talking about your temperature, your blood pressure, your heart rate, and your oxygen level. If any of those vital signs show any worrisome trend, meaning the blood pressure is either too high or too low, the heart rate's either too high or too low, or the oxygen level is too low, then being in the hospital is really the safest place to be. And then finally, you might find yourself in a circumstance where the pain is just out of control. If pain from some sort of inflammatory condition has rendered someone immobile or can't take care of themselves, then it might make sense to be in the hospital. Okay, so let's talk a little bit about the people that you're going to come across in the hospital. Now, the hospital is an entire city. And so there are going to be a lot of different people that you come across. The main people are going to be your nurses, your doctors, and the other members of the healthcare team. So nurses really run the show in a hospital. They are the heartbeat of a hospital. They are the ones who are truly taking care of the patients, in my opinion. So be nice to your nurse. They work in shifts for the most part, and they can be caring for anywhere between 1 to 5, 6 patients at a time. Doctors have their role in the hospital has kind of taken a very similar turn the way nurses do, in that the doctors tend to only work in the hospital. So let me back up. So way back in the day, like before my time, if you had to be in the hospital, then your primary care doctor would be the person to take care of you in the hospital. So they saw you in the clinic and they took care of you in the hospital. Those days are long, long gone. About 25 years ago, this specialty of hospitalist care really started to gain momentum. And now it is quite honestly the norm. Like a lot of things within medicine, the hospital environment has become super specialized and really requires its own specialty. And so the doctor that you see in the hospital will most likely not be your primary care doctor or really a doctor you know at all. Another truth is that you cannot assume that the doctor who is taking care of you in the hospital is communicating with either your primary care doctor or your rheumatologist. It is disappointing, but it's true. It's not unusual, especially when you have an autoimmune condition and you're in the hospital, to need to see specialists, sometimes multiple specialists. And if you have a rheumatologist and they say that we need a rheumatologist, you might be thinking to yourself, that's perfect because I really like my rheumatologist. Just call my rheumatologist and she'll come in, she'll help you and answer all your questions and she'll come see me. And that certainly makes a lot of common sense. Unfortunately, our healthcare system doesn't always follow common sense. And there are a number of reasons why you might not end up seeing your own specialist. One is that specialists tend to work on a on-call schedule, and you might simply be admitted during a time when your doctor is not on call. Another possibility is that you are currently at a hospital where your specialist doesn't work. And that can happen for any number of reasons. One very common reason is if you end up having to need an ambulance, the ambulance will not take you to the hospital of your choice just because all of your doctors happen to be near that hospital or work at that hospital. They will take you to the hospital that's closest, which, if you consider the idea of an emergency, that makes sense. Now, there are a slew of other people that you'll come into contact with when you're in the hospital. Therapists such as physical therapists, occupational therapists, speech therapists, dietitians, and social workers. At times, I know that when you're in the hospital, it can feel like your door is like a revolving door of just various different people coming in to ask you questions and to help you and like not leave you alone. So, big picture, the two main reasons someone with an autoimmune condition can be in the hospital are issues because of their autoimmune disease or issues that have nothing to do with their autoimmune disease. Just keep in mind, just because you have lupus or rheumatoid arthritis or scleroderma or whatever, doesn't mean you can't also get appendicitis or a bad kidney infection or need a surgery. Plenty of times people with autoimmune conditions can end up having to be in the hospital for reasons that have nothing to do with their autoimmune condition. For the sake of this video, I really want to focus though on the circumstances where it is because of the autoimmune condition. So if we just focus on that, if there's any concern that someone's autoimmune condition is somehow behind them feeling sick enough to need to be in the hospital, there are two main things the doctors are worried about. One is this a flare? Because really any of our autoimmune conditions can flare. Or is this an infection? It is very common in patients with autoimmune disease to be prone to infections, not only from their actual disease that kind of messes with their ability to fight off infections, but many times patients will need to be on medications that can mess up their ability to fight infections. So those two concerns are always top of mind for any doctors that are coming and evaluating and trying to care for someone with an autoimmune condition in the hospital. Okay, so I want to now talk about the idea of knowing why you went to the hospital and what the final diagnosis was and how those things might not be the same. I find a lot of times people don't maybe truly grasp how the diagnosis could morph and change throughout a hospital stay, and how important it is to know what the ultimate diagnosis was. We always remember why we went to the hospital. I went because I was having fevers and I was throwing up, or I was having severe knee pain, whatever it is. We always kind of remember that. But then hopefully we feel better and we leave the hospital and we're given a bunch of paperwork, and we might not really understand what ultimately the diagnosis was, or we might have an incomplete understanding. And it's really important that we know what our diagnosis is, because it will help guide our treatment and our path forward, so that hopefully we don't go backwards and end up, God forbid, back in the hospital. And so what do I mean? Like, let me give some examples. So let's say you have someone with lupus. Perhaps they've never really had severe lupus. They've had some joint pain and rashes and that kind of thing. They then develop fevers, cough, and shortness of breath. They can't breathe. They go into the hospital, and somewhere early on, whether it's in the emergency room or one of the first few doctors that you see, you kind of hear the word pneumonia, and you know you're given antibiotics. End up back in your rheumatologist's office, and if you don't quite understand that you didn't have pneumonia, you had lupus pneumonitis, that can be a very different path forward for you. That those two roads are completely different. So it's really important you know what the final diagnosis was. Okay, so let's talk about what to do after you leave the hospital, when you're going to see your doctors again in clinic. I'm going to just really kind of give you some hard truths here. We cannot assume that our doctors, our primary care doctors, or our rheumatologist have received or have looked over our records from when we were in the hospital. Even in situations where your doctor is connected to the hospital system or uses the hospital computer system, you can't assume that they've had a chance or have looked over all of your records from when you were in the hospital. I have always said that the best person to keep track of your records so that your healthcare team can know what they need to know in order to make the best decisions with you for your care is you. Now, what is the right information you need to know after a hospital stay? Because honestly, if you've ever seen hospital records, even from like a 4-day hospital stay, it will be this much paperwork, and 75% of it is like trash. It's like not important information. So what is the important information? Well, really just start with the basics. The name of the hospital, the name of the main doctor, and the dates you were there. Then, what was the final diagnosis? Sometimes, again, depending on how long you're in the hospital, someone's journey can go all over the place. Really just need to know what was the final diagnosis. Then it's important to know what tests you had done. And you don't need to kill yourself trying to be exact with the date the test was done or know all the test results. Just knowing what test you had done is super important, so that then your doctor and your doctor's clinic can take it from there and then request that information. And same with treatments. Knowing the treatments you had. Again, you don't need to get into the weeds as far as what the dose was and how often you got it, whether it was every day or twice a day or whatever. That's not important. Just knowing that you got antibiotics, or knowing that you got steroids or blood thinners or a transfusion. Just those basics is really important and helpful for your doctor when trying to figure out what treatments you need moving forward. Okay, so you might be asking, all right, I get it, but how in the world am I, a non-healthcare, non-doctor person, supposed to keep track of all of this stuff when, by the way, I feel like crud because I'm the one in the hospital? And that is a fair question. And, if you're lucky enough to have friends or family who are with you during this time, then obviously you're very lucky and you have people who can kind of jot all this down. But if you don't, or even if you do, I think it can be very helpful to have some sort of tool to help kind of guide you and remind you of what information is needed. And that's why I developed the very creatively named Hospital Day Summary and Hospital Stay Summary. I really should have thought of something that kind of differentiated them a little bit, but I just couldn't. So it's Hospital Day Summary and Hospital Stay Summary. And these were developed literally just to help you remind yourself of what you need to know and easily jot it down. You can access these forms in a link in the description box. You can go down there and just click on that link and they're yours forever to download and print. So let's just go through them real quick. So the Hospital Day Summary is just that. It's going to give you prompts to write down what your day was like. You start every day with how you feel. You can then use this to communicate with the millions of people who will come into your room and ask you how you feel. You can say you're either better or worse than the day before and kind of give your main symptoms. There's also an area for you to jot down what the plan is for the day. Are you going to have a test done? Are you going to work with physical therapy? Are you just going to rest? I think it's a great simple form just to have by your bed. It's also great when you have friends and family who are checking in on you and want to see how things are going, want to know if you have spoken to that specialist yet, have you worked with the speech therapist yet. You know, you've got it all right there, and you can either turn to it when you're on the phone with them or just kind of point to it when they come to visit you so that they can just see for themselves what's been going on. And you know, you fill this out every day, and before you know it, you've got your hospital diary right there ready so that you can take that to your doctor. The Hospital Stay Summary is another one-sheet, simple, fillable form for you to just jot down all the key things that happened to you while you were in the hospital. And when I say key things from the doctor's perspective. So you're gonna be able to take note of what treatments you got, the names of the doctors that you saw, the tests that you had done, really like the key things that then you can take back to your doctor to then they can then take it from there and request the appropriate records from the hospital to get the actual results in their hands. I know a lot of patients, because I've seen it, will keep their own version of a hospital diary with a little book by their bed and they'll jot down notes or whatnot. And I think that's great. But what this does is it has the information that doctors will need to be able to take what happened to you in the hospital and then apply it to what they're doing for you to be able to move forward with your treatment. And sometimes the things that we jot down and are important to us are not necessarily the things that your doctors need to know to be able to make recommendations as far as treatments moving forward. So that's what the Hospital Day and Stay Summaries are. I hope you find them helpful. I hope you found this video helpful. I know, like I said, this is not a topic that we talk about until it's too late and we're already in the hospital and kind of in the thick of it. And I really think that we need to have a good idea of what goes on in the hospital, what we should be keeping an eye out for. Again, I am well aware that when we're in the hospital, we're the ones that feel bad, so maybe we're not thinking straight. So maybe send this video, bookmark this, and send this video to friends or family who might also be really involved with your health care. I know the hospital is a super scary place. I've worked in hospitals for about 20 years. I know exactly what goes on in them, and there's certainly been times where I've been amazed that people have managed to get better despite the hospital. That being said, I also know that the hospital is sometimes, especially for an autoimmune patient who's facing a very severe form or complication of their autoimmune condition, the hospital can truly be the safest place for them. And so I just wanted to kind of pull back the curtain a little bit on what happens and really arm you with this information so that you can go into it as prepared as possible. I hope you liked this video. If you did, please hit that like button. If you want to hear more content like this, hit subscribe. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness because we believe it's all connected. Thanks and have a great day.